guys, my name is Kaitlin. Today I'm talking about the Zika virus. The Zika virus is primarily spread through the bite of an infected mosquito. These are the same mosquitoes that spread other viruses like the dengue virus and the chikungunya virus. Only about 1 in 5 people infected with the Zika virus will feel sick. And those that do, symptoms are usually mild, but can also include fever, rash, joint pain, red eye. Zika is primarily spread to people through the bite of an infected mosquito. It can also be transmitted from a pregnant woman to her baby during pregnancy, though we do not know how often the transmission occurs. There are also evidence that the Zika virus can be sexually transmitted by a man to his partner. At this time, there's no evidence that the woman can transmit the Zika virus to their sex partner. And some of the latest information that has come up about the Zika virus, the first American has died from complications related to the Zika virus. A Puerto Rican man in his 70s died in February from complications related to severe ITP. The man from San Juan area fell ill with the Zika virus and experienced symptoms including fever, rash, and joint pain. After recovering from the Zika virus symptoms, the man then developed the immune disease ITP, an autoimmune disorder that has linked to the Zika virus. The bleeding disorder that killed the man was a side effect of the ITP. Although Zika virus associated deaths are rare, the first identified death in Puerto Rico highlights the possibility of severe cases, as well as the need for continued outreach to raise health care providers' awareness. Another one is the brain damage for babies there is a lot worse than they were expecting. The scale of prenatal damage by the Zika virus is far worse than past birth defects associated with microcephalia, a condition characterized by a small head and brain abnormalities. Scans, imaging, and autopsies show that Zika eats away at the fetal brain. It shrinks and destroys the lobes that control thought, vision, and other basic functions. It prevents part of the brain not yet formed from developing. The Zika virus is worse in Puerto Rico than anywhere else. Nowhere in the United States has hit larger by the Zika virus outbreak than Puerto Rico, where 570 people have been diagnosed with the virus, including 48 pregnant women. They have awarded $5 million to 20 healthcares to help out in Puerto Rico. The money will help expand the family planning services, including contraception, outreach, and education. Some of the symptoms include are vague and last up for a week. Diagnosis of the virus is typically confirmed with blood tests. Some of the symptoms can include fever, rash, joint pain, red eyes, muscle pain, headaches, and pain behind the eyes and vomiting. According to the Pan America Health Organization, only 1 in 4 people are infected with the virus, but the CDC states that it is actually 1 in 5. In the past, there's also been reports of patients developing Guillain-Barré syndrome following the Zika virus infection. Guillain-Barré syndrome is a rare but serious autoimmune disorder that affects the central nervous system. Infected with the Zika virus is rarely severe enough to warrant hospitalization, and is rare for an individual to die as a result. Some things you can do to help prevent the Zika virus, even though there's no vaccination to prevent the disease. The best way to prevent the disease by mosquitoes is to protect yourself from getting bitten. You can wear long-sleeve shirts and long-sleeve pants when you go out. You can stay in places with air conditioning that uses window, door screen, or netting to keep mosquitoes out. You can use Environmental Protection Agency (EPA) registered insect repellent. You can also treat your clothes with chemicals before going outside to help keep the bugs away. And also, if you're traveling overseas, you can sleep under a mosquito bed net. And if you're sleeping outside, or if you're not able to protect yourself from the mosquito bites. Some of the people who are contracting the disease, the people that are contracting in areas where infected mosquitoes are present, include South America, Central America, and the Caribbean. As the CDC notes, specific areas where the Zika virus is being transmitted are likely to change over time. So if you're planning on leaving the States, you should check and make sure that where you're going does not have the Zika virus. And if it does, you should take the precautions to help prevent it. And then in the United States mainland does have the infected mosquito, but are the specific species of the mosquito that can become infected and spread the Zika virus. The U.S. travelers who visit a country where the Zika virus is found could become infected if bitten by a mosquito, and if they come back to the United States and get infected by another mosquito, they can transmit that disease to that mosquito, and then it'll just keep spreading down the line. With recent outbreaks in America, the number of Zika viruses case among travelers visiting or returning to the United States will likely increase. These imported cases may result in local spread of the virus in some areas of the United States. The CDC has been monitoring these epidemics and is prepared to address cases imported into the United States and cases transmitted locally. When you're pregnant, that's when you should really, as opposed to someone who's not, then you can not only infect yourself, but you can infect your baby. There's a link between the serious birth defect called microcephalia, a condition in which a baby's head is smaller than expected, and other poor pregnancy outcomes and Zika infections in a mother during pregnancy. While the link between Zika and these outcomes is being investigated, the CDC recommends that you take special precautions if you fall into one of these categories. If you are pregnant any trimester, you should consider postponing travel to any areas where the Zika virus is active. If you must travel to the active regions, talk to your doctor first and follow the steps to prevent the mosquito bites. If you are trying to become pregnant, before you travel, you should talk to your doctor about your plans to become pregnant and the risk posed from infection. There has been some tests to take if you do think that you have the Zika virus. The first commercial test for the Zika virus has released emergency use authorization. According to the test developers, Quest Diagnostics, the newly approved diagnostic tool will become available to physicians in the United States and Puerto Rico as early as in the next few weeks. Puerto Rico is considered to be among the first or the most affected areas compared to the rest of the United States, with potential for 100 more infections. Currently, people who suspect they are infected with the Zika virus can only be tested through a network of laboratories approved by the U.S. CDC. The current process requires a visit to physicians who must then go through the health department to get sample tested. Results can take up to 3 weeks, and some of the people in the United States have reported challenges in getting tested, despite meeting the testing criteria. The new authorization is hoped to increase capacity for testing in the United States as well as shorten the time taken to receive diagnostics. The commercial test uses a process known as real-time RT-PCR to test for the presence of Zika virus in blood samples. This means it can only detect the virus when it is still present in blood. A negative test, therefore, does not conclude that the virus isn't still in the body. Additional tests include those that look for presence of antibodies in the virus. Another test is called the Zika MAC-ELSA. This test looks for protein in a person's blood and a specific type of antibody that shows what foreign things the body has fought off recently. The Zika MAC-ELSA is widely seen as the best test available right now because it works over a longer time span than the first option. It also is faster and cheaper than the other tests. It requires less specialized training to perform. According to the CDC, Zika antibodies appear in the blood starting 4 to 5 days after the start of the illness and last up to 12 weeks, or even longer. The CDC has produced about 100,000 of these test kits and is offering them to free to qualified labs. But there is one drawback. The tests sometimes tell people they had the Zika when they didn't. And the last test is called PRNT, a plaque reduction neutralization test. Because the PRNT is expensive and takes at least a week longer to do than the Zika MAC-ELSA, the ELSA test is widely considered to be a more practical option in many cases. Anyone who is living or traveling to the areas where the Zika virus is found is at risk for the infection. So make sure you take the special precautions when you're traveling to other states, and if you find out they're in the United States, to make sure you just take the right precautions.